Good morning. I'm Mary Beth Morgan. I'm the manager of the Benefits Department here at MCC, and I will be your presenter today for Open Enrollment 2021. I also have Tiffany and Isabel here to help answer questions as we go through the presentation. The agenda for today is we're going to just quickly review what makes a successful open enrollment, review the schedule, go over what, why, and when we have open enrollment, provide you some quick updates on what's happening with the MCC benefit plans, review your responsibilities during the open enrollment period, review how to enroll, also let you know what the employer responsibilities are during this period, and then review post-open enrollment, and then go to the questions that you asked throughout. So what makes a successful open enrollment? Well, it's a partnership between MCC, the participating employers and employees. And our goal is to ensure that employees receive the opportunity to review and update their benefit options to best meet their needs for the upcoming year. So we all play a role, and I'm going to be going over your roles and the employee's role as we go forward. Here's the open enrollment schedule. As you know, we've notified you that it's coming. We're having our webinar today. Announcements have gone out to the employees through the mail, giving them a brochure announcing the changes. Then we have the open enrollment period, which is October 15th to November 4th. So nothing can be done in terms of making election changes until the 15th, and they must be completed by the end of the day on the 4th. By November 11th, we need any documentation for people who are adding dependents. By the end of November, you will receive the open enrollment change reports and the benefit confirmation statements that you will distribute out to your employees. By the end of December, new ID cards for the medical plans will be mailed out to the participants. The elections will become effective January 1, and then any payroll deduction changes that you have corresponding to the election changes will need to be made for that first pay in January. So open enrollment, what can employees do during the annual open enrollment? Well, they can change their medical plan. They can enroll or disenroll in medical, dental, vision, or optional life. They can enroll or disenroll dependents in any of the medical or any of the benefit plans that have dependent coverage. That would include any children and legally domiciled adults. They can enroll in the optional life plan. They can enroll or re-enroll in the flexible spending accounts. And why do we have this? Well, as a participant in the MCC Section 125 cafeteria plan, employees must be provided the opportunity to change their health plan elections and FSA enrollments every year. So we're required to do this. And when will these changes become effective? They're going to become effective January 1, 2021. And remember, federal regulations require that anyone who wants to participate in the flexible spending accounts, either the healthcare or dependent care, must actively enroll each year. Enrollments do not roll over year to year for the FSAs. So now I'm going to go into the updates for the upcoming plan year. I'm going to quickly touch on the Blue Care Network Blue Elect Plus medical plan that's now being offered. I'm going to go over the modifications to the PPO high deductible plan, talk about the pharmacy benefit carve-in, tell you about the combination of the PPO1 and clergy supplemental health plan, and announce a new flexible spending account administrator, and then also review what we're doing for the optional life enrollment for 2021. This is going to be able to allow those who aren't currently enrolled to take this without providing evidence of insurability, also known as EOI. So Blue Care Network. I think we have a lot of interest in this plan based on the calls we're already receiving. But Blue Care Network, it's the Blue Elect Plus plan that we are offering. And this is a plan that offers the managed care benefits of an HMO with the ability to choose your own provider without the need for referral. So Blue Care Network Blue Elect Plus has some great features. It has the largest HMO network of doctors, hospitals, and specialists in the state of Michigan. It also provides access to in-network providers outside of Michigan through the Blue Card program, so the Blue Cross Blue Shield nationwide program. Self-referral option is available, so you can self-refer to a specialist without having to go through a primary care provider. Provides in and out of network coverage. Of course, going in network is going to provide the lowest out-of-pocket cost to participants, but they do have the option of going out of network and still having a level of coverage. It also offers a comprehensive coverage for the prescription drugs. Currently, we had been carving out prescription drugs to Express Scripts, but for Blue Care Network, it's part of the plan and it will be part of the Blue Cross plans, which I'll go into later. The specialty pharmacy program will be through Walgreens. So anybody who joins this plan and has some specialty medications, they will need to go to Walgreens for that. It also has the Smart 90, which I forgot to include on here, and that's for maintenance drugs. If anybody's on a maintenance medication, they will need to go to the Walgreens or mail order and get their 90-day supplies through them. It's just another way to help keep our health plan costs down. Under Blue Care Network Blue Elect Plus, participants will be required to select a primary care provider. And that primary care provider is responsible for the care they will receive from basic health services, including wellness visits and routine screenings, to treatment for illnesses such as earaches and coughs and sore throats. So that primary care provider means that they have a knowledgeable healthcare professional focusing on total healthcare. And studies have proven that when a person has a primary care provider that they regularly see for care for preventive and in treatment of illness, they usually have better health outcomes than somebody who does not have a PCP. So once somebody enrolls in Blue Care Network, they will have the opportunity to select their own primary care provider, and they will be required to do that. BCN wants them elected within the first 90 days of coverage. We ask that that be done by the end of January, just to make sure that they have that person selected and ready to go. The elections won't be able to happen until they get their card. And after they get their card, they'll be able to go online or call BCN and select that primary care provider. If a primary care provider is not selected, Blue Care Network will assign one to the participant. And that PCP will be somebody in their geographic area who's accepting new patients. The Blue Elect Plus, as I mentioned earlier, does allow for self-referral, so they can self-refer out to specialists and other providers without having to go through their primary care provider. This is a little bit different than the HMO of old days where you had to send everything through the primary care provider and get the referral approvals through them. This allows for the self-referral. There'll be more information on the Blue Care Network Blue Elect Plus plan, benefits at a glance, which goes through much more detail of what's covered under the plan, and that will be available out on the open enrollment and our website under the medical plans, and that's true for all of our plans as well as a side-by-side comparison. So the next plan I want to talk about is our PPO HD. It's a high deductible plan, but up until this coming year, it hasn't been one that's compatible with a health savings account. So because we received a number of calls about that, we decided to make some minor adjustments to the PPO HD to make it compliant for health savings accounts, which means we removed all flat dollar copays and made everything subject to the deductible and coinsurance except for preventive care. Preventive care is always covered at 100% under the PPO HD, the PPO 1, PPO 2, and the Blue Care Network Blue Elect Plus plan. So for those of you who might not be familiar with what a health savings account is, a health savings account is another method to provide tax-free money to pay for qualified medical expenses. So somebody who wants to participate in a health savings account would put money and that month into the account, and it is non-taxable and it can grow from year to year and is invested. That's different from a flexible spending account. Please be aware that MCC is not offering an employer-provided health savings account option, but employees who participate in the PPO HD can go out to a financial institution and set up a health savings account directly with them and then put their money in there. And they can do that through a payroll deduction, just like they would with any kind of direct deposit. But we chose not to do that this year because they're quite complicated, and we just thought it was best that we change the plan and allow people to participate outside of MCC. The pharmacy benefit, we're really excited about this. We've had Express Scripts as our pharmacy benefit manager for a number of years, and they've done a really, really good job. But it is kind of confusing for our members because they present their Blue Cross Blue Shield card at the pharmacy and they're told they don't have pharmacy coverage. And so to help improve the experience for our members, we chose to carve in the pharmacy benefit with Blue Cross Blue Shield. So they will have one card. So for PPO1, PPO2, and PPO-HD participants, the pharmacy benefit as of January 1 will be directly through Blue Cross Blue Shield, and Express Scripts will be going away. Now, if anybody in the mail order program through Express Scripts as of the end of the year, they will be transferred over from Express Scripts to Blue Cross Blue Shield. The participants shouldn't have to do anything. It should just carry forward without any issue. The one thing that people get concerned about when there are changes in pharmacy benefit managers and who's carrying it is a change in their copays. Now, our copays are going to stay the same, but the formulary may change. So what now might be considered a preferred medication may go into the non-preferred, and there is a higher copay for that. It's a formulary change. This can happen whether you're staying with the same pharmacy provider or not. Formularies are always under review and moving around as different medications come on board and efficacy and value of those drugs changes. So just wanted to make you aware that you or your participants may see a change in what category their medications may fall under. The last medical plan option I want to tell you change for is the diocesan clergy health benefits. Right now, the current state for our diocesan clergy is they have the PPO1, the Blue Cross Blue Shield PPO1 plan, and then there's this clergy supplemental health plan that covers the mental health and substance abuse at a higher level than what the PPO1 plan currently has. And so they would go through that for that coverage. And there's two billing items that are on your monthly invoice. There's the PPO1 bill for the priest, and then there's the supplemental health charge of $50. What we've done in order to simplify this, make both plans, we've combined the two plans. So now it's a PPO1 diocesan clergy plan, and it has a higher level benefit than the regular PPO1 plan, and you will see one billing item on your monthly invoice. And what we've done is we've taken the PPO1 monthly charge, added the $50, and that will be your new invoice item beginning in the January invoice for your diocesan clergy. Flexible spending accounts. This one I'm really, really excited about because we're getting a new partner for administration of the healthcare and dependent care flex spending accounts. We are switching to Health Equity. They are a preferred provider with Blue Cross Blue Shield of Michigan, and the claims data for the PPO plans will be fully integrated with Health Equity. What this means is anybody who's participating in the healthcare flexible spending account and has a Blue Cross Blue Shield PPO plan, their claims data will be shared and their health flex spending account claims will automatically be substantiated. So that eases the substantiation requirements for flex spending. And that's going to make life easier because we're also going to offer the Visa card for the health flex spending, which means you can go in and pay for those eligible expenses right with the card, and it pulls right from the health flex spending. No more filing claims. There still may be a need to substantiate a claim if there are any questions, but that will also be easier because there'll be an online portal, a mobile app, or they can do it the old-fashioned way, mail it in or fax it. Health Equity has member services available 24 hours a day. So if anybody has questions or need assistance. On the mobile app and the portal, participants will be able to not only file claims, but they'll be able to see what's going on with their account. It's just going to be a much more robust program, and we encourage people, this is a great way to pay for healthcare and dependent care expenses on a pre-tax basis and not have to worry about filing it as a deduction when you file your taxes. So active enrollment is required each year by the IRS for healthcare and dependent care flex spending, as I mentioned earlier. So anybody who wants to participate in these plans must actively enroll during the open enrollment period. There are an increase in the maximum for the healthcare flex spending. It's now going up to $2,750 for the year. Dependent care remains the same, has never changed. It's $2,500 for those who file individually or $5,000 for joint income tax filers. When they go to elect, they're going to make an annual election, and then we will bill you monthly for that on the invoice, and then you would deduct over the course of the plan year, take the annual elections and divide it by the number of pay periods that you have during the year. Once a person enrolls in the flex spending with Health Equity, they will get a welcome kit along with their Visa card to use for health flex spending if they choose the health flex spending. The Visa card is not available for dependent care, but the welcome kit will give them the information on how to access their mobile app, the website, etc., and how to file claims. Optional life. So for those of you who offer optional life to your employees, Unum is allowing us to have what's called a full open enrollment for the optional life plan, which means anybody who did not enroll when they initially were offered the benefit can enroll without having to provide evidence of insurability. There is one exception to this. Anybody who has tried to enroll in the past and they were denied because of some pre-existing condition or a health condition, they can try to enroll again by submitting an evidence of insurability. Now, our website, when they go to enroll, it is still going to ask them to fill out an EOI, but they will not need, those who have never tried to enroll before, they won't need to complete that. They can just skip over that. Just to remind you, we do have a legacy spousal life option. There is no new enrollments for that, but you may have employees that have that as a legacy coverage. Anybody who had it when we removed it in 2016 can continue to have that. Remember, the optional life is totally employee paid, and it's done as an after-tax payroll deduction. So next steps. Your responsibilities. Please inform your employees that open enrollment is coming. Make sure that they know what benefit plans that your unit offers and how much you charge for the employee share for medical, dental, and vision. Remind them that there are instructions on how to complete the annual enrollment out on our website. They can always call us or they can do it through the ESS. Also remind them that flexible spending accounts require an active enrollment each year. Just a side on that, make sure you let your priests know that they need to do the FSA enrollment as well. It's inevitable every year that we have a couple of them call after the open enrollment period and say, I forgot to complete my open enrollment for FSAs. So if you could remind them as well, that would be great. Make sure you let them know what happens if they do not actively enroll. And provide the employees with the annual mandatory notices. Those are available out on our website. It's actually one form with 3 separate notices included in it. We also want you to get an annual salary reduction agreement from each employee. This is what authorizes the payroll deduction. We have the form that we suggest they use because it goes through the language of the pre-tax deductions and the fact that this locks them in for the year and they cannot make any changes for those pre-tax benefits unless there's a qualifying event. There's one thing I forgot to go over on the flexible spending accounts. I mentioned that we had the Visa card, but because we're offering the Visa card, we want to reiterate to the participants that they should not be using this for items that are not in line with Catholic values. So there are items that are specifically excluded from our health plans, and those are also the items, contraceptives, elective abortions, that cannot be used with the healthcare flex spending account. They're not going to be stopped from using it when they go to use it as a swipe card. So we just ask that you remind them that that can't be used for that. And they will be signing that acknowledgement when they fill out that annual salary reduction agreement. So how to enroll? They can enroll through employee self-service. This is the website. The open enrollment website will be opened at midnight on the 15th. So they'll be able to go in and start enrolling at that time, and it'll stay open until the end of the day on November 4th. The website, the ESS site, is available 24 hours a day, 7 days a week, so they can go in at any time and do it. It's relatively easy to use, I think. Plus, there's a ton of information out on the open enrollment site regarding the benefit plans. Employees are also able to contact the employee benefits team. They can call us Monday through Friday, 8 a.m. to 5 p.m. Our number is 800-395-5565. And we'll help them complete the enrollment. The one thing we always want to remind employees, and make sure you remind your employees, is that they need to complete the enrollment process. So they need to go through all the steps, and at the end, they need to complete, and it will tell them, you've completed your enrollment, here's what you have. We highly encourage them to do a screenshot of what they have as a reminder of what they elected, and then when they get their benefit confirmation, they can compare the two. That's if they're going through and doing it on ESS. Obviously, when they're going through the benefit team, we will walk them through that entire process. Please, please remind them not to wait until the very last day to enroll. I say get in there and enroll as soon as you can. Enrollments must be complete by November 4th, 2020. We will not take any changes after that date. Here's a list of the annual mandatory notices. These are required by law that they are given to employees or participants of the health plan once a year. They're available out on our website. So please make sure they get this. Just print it off and hand it to them if you need to. So payroll deductions in section 125. So our medical, dental, vision, and flexible spending accounts, as I mentioned earlier, are part of the cafeteria plan. That means that any employee contribution is taken pre-tax. And the annual salary reduction agreement that I mentioned earlier authorizes those payroll deductions and reviews the rules of the section 125 plan. It also is just another verification of what the employee selected. This is not a form that comes back to us. This is something you retain for your records. It is not their enrollment form, but they should make sure that what they have listed on the salary reduction agreement form matches what they actually elected. So employees have responsibilities as well. They're responsible for knowing what their benefit plans are that are offered to them. What options are you offering to them? And what is the contribution amount they are being asked to pay towards that plan? So they need to review the benefit elections that they currently have Who do they have covered? Which dependents do they have covered? And have they had any life changes that impact their benefit needs? For instance, have they had a child and they might want some more life insurance, so they want to enroll in that optional life? And then they're responsible for making those benefit elections and updating their benefit data. So they're going to again do that through employee self-serve or calling us no later than November 4th, but no earlier than October 15th. So if they're adding dependents or a legally domiciled adult, they need to make sure they provide us with the legal name, social security number, and date of birth of that dependent or LDA. And we have to have the documentation of these dependents no later than November 11th. So for dependent children, we need a birth certificate. If it's somebody that's going through the adoption process, the adoption documents, or legal guardianship documents. For the LDA, we need the LDA certification form. These documents can be sent to MCC. They can be uploaded through the employee self-service. They can be faxed to us at the fax number listed, 517-316-3690, or they can mail them to us. If they give the documents to you as the bookkeeper, you can also upload through BSS, but please make sure you notify us when you upload a document onto bookkeeper self-serve. The other thing that employees should be looking at during the open enrollment, because its benefits are on their mind, is we ask them to look at their beneficiary designations. And separate beneficiary designations are needed for life insurance, voluntary life insurance if they have it, and the retirement plans. So that's the lay retirement and the 403B if they're enrolled in that. And each one needs a separate document naming a beneficiary. We can't apply the beneficiary that they listed for lay retirement to their life insurance benefit. So the beneficiary designations can be viewed for life and voluntary life and LIRP right through employee self-serve. During the open enrollment, they can update their life insurance and optional life insurance beneficiaries, but they cannot update the lay retirement online. There's a form for that, and they can access it right on our website, or if they want to call us, we can email that form to them, have them complete it, and then send it back to us. There's also a form for the life insurance beneficiaries as well, if they would rather fill that out, or if they call us to enroll and they want to fill out a form just to document that. And all the beneficiary forms are available on our website. So what happens if the employee does nothing? I asked you earlier to remind your employees what happens when they don't take an active role in enrollment. If they don't take any action, their current benefit elections are going to roll over to next year, except for flexible spending accounts. Because remember, those need active re-enrollment every year. Now, I do want to mention here that there are a couple units that have changed the medical plan options that they're offering this year. And so if you drop, say, PPO 1 and you had employees that are currently enrolled in that, but you're not offering it for next year, those employees, if they want to have medical coverage, are going to have to do an active enrollment. So remind them of that, okay? No changes are going to be allowed after 11/4, and no changes are allowed during the plan year without a qualified life event. And those are rules under the Section 125 of the Internal Revenue Code that we cannot allow changes unless there's an event that qualifies them to make a change. Remember that, that's the unit benefit plan offerings, that last one that's regarding if you changed your options, that they really want to take an active enrollment, especially this year with the Blue Care Network, Blue Elect Plus plan. Employees really might want to take an active enrollment. And I know just by the number of calls we received so far on that plan that there's a lot of interest. So we really, really encourage that active enrollment. Post-enrollment, so towards the end of November, hopefully the week before Thanksgiving this year, but it might be a little later. I'm not going to guarantee anything. We will have the change reports and the benefit confirmation statements out to you. Make sure that you print off and give the confirmation statements to your employees. That confirms what they're locked in for the 2021 plan year. The change reports are for your use, so you know how to update any of your records and payroll deductions. So December, that's whenever you're doing those payroll deductions on your pay system, that's when you want to get it for that first pay in January. And then you're going to get your first invoice for January. So you want to take particularly close attention to that detailed report for the invoice, just to make sure everything's matching up with as you expected based on the change report that was sent. So in summary, open enrollment, October 15th to November 4th. Enrollment can be done through employee self-serve or by contacting the MCC benefits team. Flexible spending accounts require an active enrollment each year. Employees must submit required documents if adding dependents no later than November 11th. You'll get those reports, the change reports and benefit confirmation statements out on BSS. We will send a memo, by the way, letting you know when they're available, so you're not guessing. We'll give you the heads up, and that'll happen by the end of November. And then the changes are effective January 1st. So do we have any questions?
There have been lots of questions that have come in throughout. A common theme was whether or not this presentation will be available. So we can make it available in a couple of ways, I think. So if you're all right with this, Mary Beth, I assume they can send an email to the benefits mailbox and get a copy of the slides we can print out. And we will also have a recording of the webinar available on our website within the next day or so. That's at micatholic.org/webinars. We've got a question from Barbara asking where the new pricing is. So I think we sent out.
We sent the new rate sheets out in August. And so you should be able to go, if you don't recall getting them, they should be in your communications on Bookkeeper Self-Serve. I believe it was the 18th that we sent the new rates out. But if you can't find it, just send an email to benefits@micatholic.org and we can resend that to you. So the rates, just so you know, the rates for PPO1, PPO2, and PPO HD have not changed. And then there'll be the rates for the Blue Care Network, Blue Elect Plus, which would be included on that updated rate sheet.
Lynette would like to know if there's a review available for employees.
They're out on, once the open enrollment site is up and running, there will be, yes, there will be it's not a webinar like this, but there are recorded presentations that go through the benefit changes. There'll be a presentation on how to enroll. There is a link out to the Blue Cross Blue Shield. There's a virtual tour of the Blue Cross Blue Shield BCN options, which is really cool. There'll be a link out to a learning site for health equity. I'm so glad you asked this question because I totally forgot to mention these items, but there's going to be a lot of information, whether they be PDF or presentations, out on the open enrollment site where employees and you can learn more about our benefit programs.
Tracy wants to know if we can include the salary reduction agreement with the online enrollment versus paper.
Yeah, that right now we don't have that availability. And the reason why is we don't know what you all ask employees to contribute to their benefit plans. So they can't really fill that out because, I mean, we don't have that information to fill that in there for them. So we can't automate that.
Jean would like to know what the main differences are between PPO1 and BCN for them to tell their employees.
There will be, when the site opens, a side-by-side comparison of all 4 plans, and it'll review. The deductible is lower for BCN. The office visit copay for primary care providers is lower. So there are variations. Some things are better. The copays on prescriptions are a little higher. So it just depends on where their, needs are, which plan might be best for them. So what I always recommend is look at that side by side, go out and look at the benefits at a glance for each plan. If there are very, very specific things you're looking for. And if there are things that are really specific, you can always call Blue Cross Blue Shield because they're the ones that can really answer some of those more in-depth questions.
Tori would like to know if the side-by-side is available ahead of time for them so they can issue to employees or take a look themselves.
Yeah, we can try to get that out to all of you right away.
Carol would like to know if units automatically offer the Blue Elect plan or do they have to opt in?
Any unit that was offering or is currently offering a MCC health plan had the BCN option automatically added to their options, their medical plan options. If they are not offering a medical plan, an MCC medical plan in 2020, they would have had to actively opt in by filling out a unit change form. And that was due to us by September 1. A memo went out about that in early August.
I think that is it for the questions.
All right. Well, thank you all so much. If you think of anything else, feel free to send your inquiries to the benefit mailbox and we will respond as soon as possible.